If you're over 60, there's something happening inside your body right now that you can't feel, but it could change your future. By your 70s, your kidneys may have already lost up to 30 to 40% of their filtering power compared to early adulthood. And nearly 1 in 3 Americans over 65 has measurable signs of chronic kidney disease, most without knowing it. No sharp pain, no obvious warning, just a quiet decline in millions of tiny filters working day and night to clean your blood. Every single day, your kidneys process about 45 gallons of blood. After decades of blood pressure swings, blood sugar spikes, medications, hidden sodium, and environmental toxins, those delicate filters begin to struggle. But here's the hopeful truth. Modern clinical research shows that certain natural compounds found in common fruits may help reduce oxidative stress, calm inflammation, and support healthier kidney filtration markers in older adults. Not hype, not miracle claims. Measurable effects researchers are actively studying. In this video, you'll discover 5 powerful fruits that may help protect your kidneys, and why the way you eat them matters more than you think. Everything you're about to hear is grounded in peer-reviewed medical research and publicly available health data, so you can feel confident this information is rooted in evidence, not trends. Number 5, blueberry. Most people think blueberries are just heart-healthy. What they don't realize is that the same blood vessels that feed your heart are the ones that feed your kidneys. And after 60, those tiny vessels become fragile. Inside each kidney are about 1 million microscopic filters called nephrons. Each one depends on flexible, healthy blood vessels to maintain proper filtration pressure. When those vessels stiffen from years of high blood pressure, elevated blood sugar, and low-grade inflammation, your filtration rate, your GFR, slowly declines. This is where blueberries become more than just a breakfast fruit. Blueberries are one of the richest dietary sources of anthocyanins. In controlled human trials involving older adults with metabolic risk factors, regular blueberry intake has been shown to improve endothelial function and reduce systolic blood pressure within weeks. Even a 4 to 5 millimeters of mercury reduction in systolic pressure can meaningfully reduce long-term kidney strain. That's not marketing, that's vascular physiology. But it goes deeper. Oxidative stress is one of the silent drivers of chronic kidney disease progression. Over time, excess free radicals damage nephron structures and increase inflammatory signaling. Clinical nutrition studies have demonstrated that blueberry polyphenols can significantly reduce markers of oxidative stress and improve nitric oxide availability, a molecule essential for maintaining healthy blood flow to the kidneys. Better blood flow means better oxygen delivery. Better oxygen delivery means less microscopic damage over time. Blueberries are also naturally lower in potassium compared to many other fruits, making them a practical option for individuals who need to monitor mineral intake. That matters especially for adults already concerned about declining kidney function. Now here's what many people do wrong. They drink blueberry juice. Most commercial juices remove fiber and concentrate sugar, which spikes blood glucose, the very thing that accelerates kidney damage. Whole berries, fresh or frozen, are what you want. About half to 1 cup daily is a reasonable amount for most older adults unless your healthcare provider advises otherwise. Look for berries that are deep blue with a natural silvery bloom. That coating protects the fruit and signals freshness. Organic options may help reduce pesticide exposure, another quiet stressor your kidneys must process. Blueberries may be small, but when it comes to protecting the delicate blood vessels that keep your kidneys filtering efficiently, their impact can be surprisingly significant. And the next fruit on our list addresses a completely different kidney stressor, one that affects millions of older adults without them ever connecting it to kidney decline. Number 4, apple. If blueberries help protect the tiny blood vessels inside your kidneys, apples work in a completely different and often overlooked way. After 60, one of the biggest hidden drivers of kidney decline isn't just blood pressure, it's metabolic stress. Elevated blood sugar, insulin resistance, excess body weight, and chronic low-grade inflammation quietly increase the workload on your kidneys year after year. And this is where apples become more powerful than they appear. Apples are rich in soluble fiber, particularly pectin. Unlike simple carbohydrates, pectin slows glucose absorption in the gut and improves post-meal blood sugar control. In clinical nutrition studies, higher soluble fiber intake has been associated with improved glycemic regulation and lower inflammatory markers, both critical factors in slowing kidney function decline. Why does blood sugar control matter so much? Because diabetes remains the leading cause of chronic kidney disease in the United States. Even modest elevations in fasting glucose over time can damage the delicate filtration barrier inside the kidneys, increasing albumin leakage and accelerating GFR loss. Stabilizing blood sugar isn't just about energy levels, it's about protecting your filtration system. But apples offer another advantage most people don't think about: the gut-kidney connection. Emerging research over the past decade has shown that imbalances in gut bacteria can increase the production of uremic toxins, compounds that burden the kidneys. Soluble fiber like pectin feeds beneficial gut microbes, helping shift the microbiome in a healthier direction. A healthier gut can mean fewer circulating toxins your kidneys must filter. Apples are also naturally low in sodium, phosphorus, and relatively moderate in potassium compared to many fruits. That makes them a practical, kidney-conscious option for many older adults when eaten in appropriate portions. However, preparation matters. Peeling an apple removes much of its fiber and antioxidant content. Clear apple juice strips away the fiber entirely and concentrates sugar. Dried apples often contain added sugars and significantly higher glycemic load. The protective effect comes from the whole fruit, skin included. One medium apple per day is generally a reasonable amount for most adults, though anyone with advanced kidney disease should confirm portion sizes with their healthcare provider. When choosing apples, look for firm texture and vibrant color. Organic options can reduce pesticide exposure, another variable that affects long-term organ health. Apples may not sound dramatic. They're common, familiar, almost boring. But when it comes to steady blood sugar, reduced inflammatory load, and supporting the gut-kidney axis, their long-term impact can be meaningful, especially after 60. And the next fruit on our list targets something even more specific: a condition that sends thousands of older adults to the doctor every year and places direct stress on the kidneys. Number 3, cranberry. When most people think of cranberries, they think of urinary tract infections. What they don't always realize is that recurring urinary infections don't just cause discomfort. They can place repeated stress on the kidneys themselves, especially after 60. Here's why that matters. As we age, immune defenses weaken, bladder emptying may become less efficient, and the risk of bacterial growth in the urinary tract increases. Infections that begin in the bladder can, in some cases, travel upward toward the kidneys. Repeated inflammation in the urinary system can gradually affect kidney health over time. Cranberries are unique among fruits because of one specific compound group: proanthocyanidins, often abbreviated as PACs. These compounds don't kill bacteria the way antibiotics do. Instead, they interfere with the ability of certain bacteria, particularly E. coli, to attach to the lining of the urinary tract. That distinction is important. Once bacteria firmly attach, infection becomes harder to prevent. But by reducing bacterial adhesion in the first place, cranberry compounds help lower recurrence risk. A major systematic review of clinical trials found that cranberry products significantly reduced the incidence of recurrent urinary tract infections, particularly in women and older adults prone to repeated episodes. Less infection means less inflammation. Less inflammation means less strain on the kidneys. But cranberries offer more than infection prevention. They are also rich in vitamin C, flavonoids, and other polyphenols that help reduce oxidative stress, one of the silent contributors to chronic kidney disease progression. Inflammation and oxidative damage don't always cause symptoms. Yet over years, they can gradually impair filtration efficiency. Cranberries are also relatively low in potassium compared to many fruits, making them a practical option for individuals who need to monitor mineral intake carefully. Now here's where people make a common mistake. They drink cranberry cocktail. Most commercial cranberry juices are heavily sweetened. Added sugar spikes, blood glucose, increasing metabolic stress on the kidneys, the exact opposite of what we want. Pure, unsweetened cranberry juice in small amounts, fresh berries, or low-sugar cranberry products are better options. Fresh cranberries are tart, but they can be added to salads, blended into low-sugar smoothies, or mixed with plain yogurt. Frozen cranberries retain most of their beneficial compounds and are available year-round. If you're prone to kidney stones, it's important to discuss cranberry intake with your healthcare provider, as certain types of stones may be influenced by dietary patterns. Cranberries may not directly increase your filtration rate, but by helping reduce infection risk and lowering inflammatory load, they address one of the most common and overlooked stressors affecting kidney health in older adults. And the next fruit on our list targets something different again, a metabolic factor strongly linked to both gout and faster kidney decline, especially in men over 60. Number 2, cherries. There's a marker in your blood that often rises quietly after 60, long before any serious symptoms appear. It's uric acid. While most people associate high uric acid with gout, large population studies have shown something more concerning. Elevated uric acid levels are independently associated with faster decline in kidney filtration rate over time. In several longitudinal studies involving thousands of adults, individuals with higher baseline uric acid levels had a significantly increased risk of developing chronic kidney disease compared to those with lower levels, even after adjusting for blood pressure and diabetes. Your kidneys are responsible for clearing uric acid from your bloodstream. When levels remain chronically elevated, uric acid can impair endothelial function, increase oxidative stress, and promote inflammatory signaling inside the kidneys. Over years, that additional strain may accelerate GFR loss. This is where cherries become clinically interesting. In a randomized controlled trial involving adults with hyperuricemia, tart cherry consumption was associated with measurable reductions in serum uric acid levels within weeks. Other clinical studies have shown that cherry intake can lower C-reactive protein, CRP, a key marker of systemic inflammation linked to kidney disease progression. In people with gout, observational research has even found that cherry consumption was associated with up to a 35% lower risk of recurrent gout attacks over a 2-day period following intake. While that study focused on gout, it highlights cherry's impact on uric acid metabolism. Why does this matter for your kidneys? Because reducing uric acid and calming inflammation reduces one metabolic pressure that contributes to long-term nephron damage. Cherries are rich in anthocyanins, the same family of compounds found in blueberries, but they also contain additional polyphenols that support antioxidant defenses and vascular health. Better vascular function means better blood flow to kidney tissue. Now, moderation still matters. Cherries contain natural sugars. For most older adults, about 1 cup several times per week is reasonable. Tart cherry concentrate can be useful, but only if unsweetened. Added sugars undermine the metabolic benefit. Fresh or frozen whole cherries provide fiber and slower glucose absorption compared to juice. Cherries may not be marketed as a kidney fruit, but by addressing elevated uric acid and systemic inflammation, two silent accelerators of kidney decline, they target a risk factor many adults over 60 never realize is affecting them. And the final fruit on our list has been studied not only in healthy adults, but in patients already undergoing kidney treatment with measurable changes in inflammatory and oxidative stress markers. Number 1. Pomegranate. If there is one fruit on this list that has been studied in people already facing serious kidney problems, not just in healthy volunteers, it's pomegranate. And that's what makes it different. Chronic kidney disease is not driven by one single factor. It progresses through a combination of oxidative stress, chronic inflammation, vascular damage, and metabolic imbalance. Over time, these forces accelerate nephron loss and reduce glomerular filtration rate. Pomegranate stands out because of its exceptionally high concentration of polyphenols, particularly punicalagins and ellagic acid, compounds known for strong antioxidant and anti-inflammatory activity. But this isn't just theory. In clinical studies involving patients on hemodialysis, regular pomegranate juice consumption has been associated with significant reductions in markers of oxidative stress and inflammation. Some trials have shown decreases in C-reactive protein and inflammatory cytokines after consistent intake over several weeks. In populations where inflammation is already elevated and kidney function is severely compromised, that kind of shift is clinically meaningful. Other research in adults with metabolic syndrome has demonstrated improvements in endothelial function and reductions in systolic blood pressure following pomegranate supplementation. Since vascular health is central to maintaining kidney filtration, improving endothelial performance may help reduce long-term strain on the kidney's delicate microcirculation. There is also emerging evidence suggesting that pomegranate polyphenols may reduce lipid oxidation and support healthier cholesterol profiles, another factor linked to vascular damage in chronic kidney disease. Now, here's what makes this especially relevant after 60. As kidney function declines, oxidative stress tends to rise. The body's internal antioxidant defenses become less efficient with age. That imbalance, more free radicals, less protection, accelerates tissue damage. Pomegranate's unusually dense antioxidant profile directly targets that imbalance. However, preparation matters greatly. Many commercial pomegranate juices contain added sugars. Excess sugar increases blood glucose variability and metabolic stress, counterproductive for kidney protection. If using juice, choose 100% pure, unsweetened pomegranate juice and keep portions moderate, typically around 4 ounces. Whole pomegranate areoles provide fiber and slower glucose absorption. And as always, individuals with advanced kidney disease should consult their healthcare provider regarding portion size and potassium considerations. Pomegranate is not a cure. It will not reverse kidney disease, but among commonly available fruits, it has one of the strongest bodies of research supporting its role in reducing inflammation and oxidative stress, two central drivers of kidney decline. After 60, protecting your kidneys is less about dramatic detox claims and more about consistently lowering the silent pressures that wear them down. Small, evidence-based choices, repeated daily, shape how your kidneys age. And when combined with the other fruits we've discussed, they create a dietary pattern that supports filtration, vascular health, and long-term resilience. Today, we explored 5 fruits, each one supporting kidney health in a different evidence-based way. Blueberries help protect your blood vessels and reduce oxidative stress that can damage delicate kidney filters. Apples support stable blood sugar and a healthier gut environment, lowering metabolic strain on your kidneys. Cranberries help reduce recurring urinary tract stress, easing one of the common inflammatory burdens in older adults. Cherries address elevated uric acid, a hidden factor linked to faster kidney function decline. And pomegranate delivers powerful polyphenols that have even been studied in patients with advanced kidney stress, helping reduce inflammation and oxidative damage. Together, these fruits don't cleanse your kidneys overnight. What they do is far more realistic. They reduce the daily pressures that slowly wear kidney function down over time. But remember, no single food works alone. Kidney protection also depends on managing blood pressure, stabilizing blood sugar, staying hydrated appropriately, limiting processed foods, and maintaining regular movement, approved by your healthcare provider. Early awareness is key, because kidney disease develops silently, and prevention always works better than late intervention. If you found value in this video, subscribe and join our community focused on helping adults over 60 protect their health with clarity and confidence. And before you leave, watch the next video on your screen. Some everyday foods, often considered harmless, may actually be increasing kidney strain without you realizing it. Stay informed, stay proactive, and most importantly, stay ahead of silent kidney decline.